They say that on average, most people move every 7 years. If the move is a considerable distance, it might require that you find a new physician, dentist, plumber, dog groomer, and eye doctor. This presentation is an effort to assist in the eye doctor part of the decision-making process. How do you choose who to go to? You could go with a flashy website, or you could ask your friends and family members, or you could seek out professional association recommendations. Go with a flashy website. When it's time to select an eye doctor, many people do it the easy way, which is probably not the best way. Traditionally, they would flip through the phone book and look at all the ads and listings. Nowadays, most people do an online search. Pop in the word eye doctor in your local city or area, and there are your choices listed for you. They may select the doctor with the biggest display ad, or the one with the sharp web design. The only real criteria most are interested in is how close is the doctor's office to their home or workplace, and how much will it cost. The doctor with the large display ad may be a great doctor, or he may be an eye doctor that is investing in the marketing dollars because he cannot retain patients in his practice after their first visit. Ask your family and friends. A smarter way to select a new eye doctor would be to ask your friends and family members whom they see for their eye care. Chances are if your family members feel comfortable with their doctor, you will too. Ask if the doctor took a thorough history, asking about their medical conditions. Did the doctor explain any problems they found in simple language? Did the doctor give them an opportunity to ask questions? Next, check out the doctor on the internet. Does the doctor's website look attractive? Is it informative? Is there helpful information available that you actually read? Or is it a sales pitch for some bargain eyewear or discount contact lenses? You're looking for a doctor. Check out the professional associations. Membership in a professional association is always a good sign. Most associations have minimal standards that the doctor must maintain in order to continue to be a member of the association. Many ophthalmologists are members of the AMA. Many optometrists are members of the AOA. A small number of optometrists belong to the AAOA, which is a more demanding organization which requires testing for admission. These doctors are noted by them using the letters FAAO after their name. How about the type of insurance you have? Do you have a vision care plan, or an HMO medical plan, or a PPO medical plan? A vision care plan. For most people, a big factor in whom you see is your insurance status. Many vision insurance plans require you see a doctor enrolled in their plan to obtain the most benefits. If you see a doctor not enrolled on their plan, the insurance may pay less than normal or not at all. Most vision plans cover an annual eye examination whether you are having any eye problems or not. If you have an eye medical problem, or if you have an eye medical problem is discovered in the vision examination, any further medical testing or treatments are normally not covered by the vision plan. Some vision plans have a rider that would cover some medical testing and treatment. HMO medical plan. Medical plans cover medical conditions. They usually do not cover routine well health exams or exams for glasses. If your medical plan is an HMO, you must go through your primary care provider, your PCP, for authorization. If your PCP is aware of a previous medical condition, or he finds a new medical condition that requires an eye doctor, he will arrange a referral to an eye doctor within the HMO structure. Most HMOs have a separate vision plan that allows you to see an eye doctor that is enrolled in their plan directly without going through your PCP for a vision exam. PPO medical plan. PPO medical plans allow you to choose your own eye doctor instead of getting authorization from your PCP. If you meet one of the following conditions, most if not all the examination or treatment fees will be covered. 1. A medical diagnosis of an eye disorder. It could be dry eyes, allergies, eye infections, conjunctivitis, corneal ulcers, conjunctival hemorrhages, styes, corneal foreign bodies, corneal abrasions. 2. A sign or symptom of an eye disorder. Eye pain, red eyes, burning eyes, itchy eyes, sore eyes, tired eyes, light-sensitive eyes. The third criteria is a history of taking high-risk medications. Some drugs, such as insulin, steroids, and Plaquenil, can cause eye damage and need to be monitored. If you do not meet one of these three criteria, the medical insurance will not cover the initial exam, but subsequent exams and treatment are covered if the initial exam finds that you do meet one of the three criteria. What type of eye doctor should you see? What's the difference between an optometrist, ophthalmologist, and optician? A lot of people are confused about this. An optometrist is an eye doctor that examines eyes, does medical testing, and medical procedures that do not require surgery. An ophthalmologist is an eye doctor that examines eyes, does medical testing and medical procedures, and does eye surgery. An optician does not examine eyes, but makes glasses from prescription determined by an optometrist or ophthalmologist. Here's a few examples for clarification. Number 1. I just need my eyes checked for health reasons and maybe get new glasses. For most people, the best choice would be an optometrist. Optometrists are truly the specialists in treating visual problems. Traditionally, they have had more experience with refraction, measuring how the eyes focus and any need for glasses, than do ophthalmologists. Also, many ophthalmologists delegate the fraction part of the eye examination to technicians without the training an optometrist possesses. These days, most ophthalmologists specialize in certain eye diseases rather than general eye care. Other examples might include, I need my eyes checked because they get red, burn, and itch, or my eyes tear often, or I have a funny bump on my eyelid, or my eyes get tired easily. An optometrist or a general ophthalmologist would both be appropriate. Other examples might include a patient that says, I am developing cataracts, I have early diabetic retinopathy, or I have early macular degeneration. In these cases, an optometrist or a general ophthalmologist would both be appropriate. If a patient says, I saw my optometrist and he said I need cataract surgery, then obviously the best answer would be a general ophthalmologist that does a lot of cataract surgery. The key to good, successful cataract surgery is to do lots of them. Another example might be a patient that says, I saw my optometrist and he said I have severe diabetic retinopathy. Obviously, he needs a retinal specialist, ophthalmologist. Retinal specialists are ophthalmologists that take extensive training in treating retinal conditions, rather than cataract surgery or refractions in general eye care. A similar situation would be when a patient said, I saw my optometrist, and he said I have significant macular degeneration. Macular degeneration can blind people, so you need to see a retinal specialist for this condition. Another example might be a patient that says, I saw my optometrist, and he said I may have glaucoma. A glaucoma-certified optometrist, a general ophthalmologist, or a glaucoma specialist ophthalmologist would be appropriate. Some optometrists treat glaucoma and some do not. Some ophthalmologists that specialize in other areas would not treat glaucoma also. So now you know your insurance status and you know the type of doctor you want to see. What's next? Check the doctor's website to see if your insurance option works for that doctor. If not, call and speak to the office manager. No one wants to get to their appointment and discover that insurance will not cover the visits. It's awkward for everyone. Download or have the office manager mail you the paperwork, because there always is paperwork. There usually is a general information form for name, address, etc., a medical history form covering current medical problems, medications taken, and any history of eye disease. Some of the questions may surprise you when you ask by an eye doctor's office. Insurance carriers now require social questions about drugs, smoking, and other lifestyle issues. The medical form should be very detailed. Every office is also required to ask you to acknowledge their patient privacy statement. Check office hours to ensure you can find an appropriate appointment time. The chains of commercial practice offer the most flexible hours, but you might find the same doctor from visit to visit. They employ doctors as employees. There might be a question of continuity. The well-established, successful private practice probably will not have as flexible hours, but you're pretty sure he or she will be there when you need them in the future. Be sure to bring your insurance card and driver's license. Doctors are now required by law to make sure the insurance identification and driver's license identification are the same. Bring any current glasses or contact lenses so the doctor can tell you how much change, if any, there is. Try to refresh your memory or bring any records regarding eye disease or surgery. It's often good to show up 15 minutes early to handle paperwork. If you're having or expect serious problems, it's often helpful to bring a spouse or family member along. Sometimes patients leave the office and promptly forget much of what the doctor told them. Well, I hope this presentation helps some. Good luck in finding that best new eye doctor. Thank you.